is it important for all of us to get the MRI and get that scan? But I know that many of us like to measure. I want to know where am I starting from so I can see where I'm going.
Okay, so
maybe you could just tell us a little bit about your theories on some of these things.
yeah, so I think getting an MRI is beneficial, but I wouldn't say it's an imperative. An imperative is changing your lifestyle, but getting an MRI if you're able to afford it, and they're getting cheaper now, Rob. In Florida, where I am right now, there's a place up in the Orlando area. You can get an MRI cheaper than a DEXA scan, $111. Some
Whoa.
DEXA scans are running $150. So the ability now to get an affordable MRI and seeing inflammatory fat that's accumulating in your muscle and around your heart becomes a more realistic metric for people to follow. And I hope more people become aware of it and start looking at it and tracking it. If you're going to go carnivore, if you're able to get an MRI, see how you change from the inside out. You're certainly going to change from the outside, and it would be beneficial. And repeat it in 3 to 6 months. And if you decide you want to go vegan, and that's what you're doing, get an MRI and see where you are today and see where you are in 6 months, and look at the loss of muscle and look at the accumulation of visceral fat. Vegans end up getting very scrawny looking, but they get this this increasing amount of invisible obesity, this visceral fat that's accumulating deep in their abdomen that you can't see in this scrawny person with no muscle, and then fat around their heart. So that's where I think an MRI can be helpful. But our ancestors did perfectly fine keeping away visceral fat from their diet by eating a meat-centric diet without reliance on doing MRIs. But they also paid attention to the tone of muscles. So I'm kind of fun to take my shirt off. I am 61 years old. I've got good tone, but I only exercise 5 minutes a day for the past 15 years. So we get these kind of bodies because we're eating correctly, we're living correctly, and carnivore doctors aren't afraid to pull off our shirts and walk around the beach. So I almost think I'm going to be the doctor besides the sprinting doctor, ferment doctor, carnivore doctor, visceral fat doctor, MRI doctor. I think I'm going to be the no shirt doctor to be able to tell people, look, this isn't from, I never took hormones. I never took steroids. I never took gear. Any point in my life, I just lived correctly. And I'm formerly an overweight fat doctor riddled with disease. And then I started living correctly, all naturally. And this is what you should be looking like. You don't have to be overly hypertrophied. You want to have a lean, muscular body that is living well, and it evidences that. So check out carnivore physicians like Dr. Rob Kiltz, Sean Baker, Dr. Sean O'Mara. We're doing the Dr. Anthony Chafee. We're trying to model this to make this more sensible and understandable for people.
And you don't have to look like us to have the feeling, because in 2 to 4 weeks of carnivore, no matter what your size is, you'll feel so much better.
Absolutely.
Then you'll be motivated to begin to move. Walking is one of the most amazing things you can do. I do my walking for an hour and my Sean O'Mara sprinting, interspersed in that. And I'll do my light weights, nothing heavy, nothing excessive, and for 5 or 10 minutes. That's it.
Yep. You don't have to exercise a long time. And, I would point, Rob, to what happens in nature. And if you look at the animals, they're not going to Lifetime Fitness and to Planet Fitness and gyms working out for 30 to 45 to 60 minutes. Or, a lot of gym bros are in there for 2 to 3 hours. And that doesn't happen in the wild. It's a very intense, highly, conflict that occurs in the lives of these animals that conditions you. And that's what you have to do. You don't have to go out and get a fist fight in some bar. You just have to do like what Rob Kiltz and Sean O'Mara does, lift some weights in a maximally intensive manner. I do push-ups and pull-ups to exhaustion till I look like, I'm going to die, and I squeeze more out, and I sprint as fast as I can. You can ease into the sprinting thing. Lots of older people just decide to go out and they're filled with disease and visceral fat and think they go sprinting and they got a hamstring tear. So you want to ease into that. And so for that reason, I tell people maybe, get acclimated on sprinting in a pool, sprint, swim, something like that. But lifting weights is a really safe way, provided you use good, decent technique to do maximum intensity exercise in a short period of time. So don't think you got to exercise long. I've averaged 5 minutes a day for 15 years, and I'm doing just great, I think.
How about how much you should eat in a day? How frequent you should eat? I mean, they say, oh, you should eat to keep your metabolism going through 6 meals a day. What's your thoughts on that?
All right, so my feelings, we didn't get to talk much about this, but I do a model called feasting and fasting. And I'd love your opinion when we get together. Hopefully you'll go to Wyoming again and meet all
I'll be
out
there.
there.
I'll be there.
Like,
We're gonna do
good.
some great stuff together.
So one of the things I think we did is we ate a lot of meat, Rob, in our ancestral existence in a short period of time. Before that meat disappeared or it rotted, became unusable. So I think, the bariatric patients that we take care of, my 600-pound life, where people, I was a medical director for a bariatric program for a while at the VA. And my question was, how many pizzas do you eat a day? How many loaves of bread do you eat a day? How many dozens of donuts do you eat a day? Get your head around, if you're listening to me, these people have an enormous capacity for eating food, carbohydrates.
Right.
Our ancestors had an enormous capacity for eating meat. If you could just simply convert those carbohydrate dependent, enormous bariatric 600 pounders from eating pounds and pounds and gallons of carbohydrates to eating meat, you would solve their pathogenic obesity and reverse them without having to do surgical interventions. So our ancestors, in my opinion, probably consumed on the order of 20 to pounds of meat a day, maybe more, because they had a stomach that would had expansion capacity to eat a lot of meat, and then they would have gone for probably 10 days or maybe longer. We don't know because we don't have recorded history, during that time period where they're hunting these woolly mammoths, but feasting and fasting. So I'm exploring that, brother. I'm looking at stretching my stomach to eat more meat. Those women, they're at hot dog eating contests, they're eating 15 pounds of meat. Modern day little women, 2025. And then, we got these carnivores that are struggling. We get them into it, and they think, my God, I feel satiated at, a pound or a pound and a half of meat. Well, just eat a little bit more. That's what I'm doing. I'm stretching my stomach for good food, not for crappy pizzas, ice cream, donuts, muffins, and bread, but for health optimizing meat.
Well, the only place for your food is actually on your body as fat because you do not burn sugar. You do not burn what you eat in your stomach directly. It must either go to lymphatics as fat, distribute everywhere, or to the liver as amino acids and sugars to be converted to fat via insulin, or you die. And so ultimately, our drive was to feast in order to put the food where it's supposed to go. Otherwise, I mean, there's no refrigerated cupboard for your next meal.
Exactly right. We are in alignment there. I think you're spot on, and I think the carnivores should be addressing that and talking about it and educating, because it's going to be, I think, our next stage. Getting people off plants, the first thing, get them eating meat, but then listen, the momentum is on our side. Rob Kiltz, we are looking good. We're living better. We can do even better if we study ancestrally what happened, and I think we did feasting. I think we had periods of fasting and feasting that actually optimized us through autophagy, helped us out, and and this great resource called meat was available to us, and we would get more in it. And I think we're going to find out that there are even better techniques, insights that we're going to get and develop.